Hi, my name is Jeannie. This is my video introduction for MSN 563, Evidence-Based Inquiry for Scholarship and Practice. My educational background, I have a bachelor's degree in psychology and biology from 1994. Then I went to obtain an associate's degree in occupational therapy in 1995. And went to nursing school finally and graduated in 2011. My clinical experience, I graduated and went right to work for an LTAC hospital, long-term acute care. Requires 3 days of ICU stay to be admitted. These people are pretty ill. A lot of them were weaning from vents, have cardiac issues, can go septic really quick, pretty ill. They receive rehab and then they go on for inpatient rehab. My experience with evidence-based practice, I went to a Methodist hospital, which was a magnet school or magnet hospital, which is where I went to school. Well, that's the hospital that was connected with my nursing school. So very focused on evidence-based practice. However, my current hospital seems like everything is handed down to us from corporate. Not a whole lot of employee engagement as far as floor care or care that we provide. Everything has to go through corporate and is handed down from corporate. Just seems like we're not really involved much. Don't have a clinical leader or education nurse, advanced practice clinical leader. It's pretty much the CNO, director of quality management, and then the house supervisors, and then obviously the staff nurses, which is what I am. I do work several jobs within this hospital. A lot of it, I've been there for 8 years. Many nurses come and go. I've worked every little job there. Seems like unit secretary, tele-nurse, charge nurse, house supervisor. I know that facility in and out. Areas of advanced practice that I'm interested in. Very focused on health, obviously on health and nutrition. A lot of people that come into the current hospital right now are obese. I'm focused on nutritional choices, food. I guess I got some thoughts here about my capstone, processed foods, regarding choices of clean, fresh fruits, vegetables, protein, effects on the heart, weight, calorie intake, and cancer risks from those choices. Also, does processed foods increase risk for cancer, or does the increased weight and poor diet of processed foods have a contributing factor, and how does it affect cancer or health risks comparatively? Also, the effects of antibiotics injected into farm animals affecting, therefore, the humans that are consuming the meat. I'm just really based on food and nutrition and effects of cardiac, weight, and diabetics. I definitely need to narrow that down, though, I'm sure. I'm going to get feedback on that. Personal goals as far as learning about evidence-based practice. I would want to use evidence-based practice in my practice as a nurse practitioner, definitely, and even in my care right now that I provide to my patients. A lot of them are obese. Vent weaning can be a challenge. Many of these folks that we care for right now are hypoxic due to obesity. Can't wean them from the vent, or they're just on their way to death due to hypoxia and their weight, not even on the vent. So it is a big issue, and especially in Omaha, Nebraska, we have a lot of obese people. I'm sure everywhere across the United States, though, there is that issue as well. But I am focused on health of diet and exercise significantly. One or two goals, or one or two things, personal items about myself. I live in, well, obviously, as I have said here, I live in Omaha, Nebraska. I am married. I have 3 children. Well, not so much children anymore. One of them is 21 years old, still living at home. She's going to school. I have 2 high schoolers, 15 and 16 years old. Chase after them. Work full time. I'm excited about this class. I do like evidence-based practice. Need to dive into it a little bit more. I feel like we really kind of lose sight of that. Well, some nurses do. Maybe some don't. I can't speak for everybody, but I know the facility that I work at, we don't talk about it much. It's not really a big focus. There should be more focus on it. I don't know what to say about that. It's kind of lackadaisical nursing, not using that. I don't feel like there's a lot of support or a lot of push for that at the facility, and I know that we should be using it more. So, but thank you very much for your time. I look forward to this class. Thank you.